Good morning and welcome to the UW-Madison Retirement Association's Committee on Financial Matters in Retirement presentation on State Health Insurance Update for 2018, ways to maximize your sick leave account, and what to do if it runs out. We have three speakers from ETF, and we're very pleased that they were able to work this into their overload schedule to come with the open enrollment coming up and starting in a couple of days. So to talk just a little bit about the speakers, Tara Prey has been with ETF since 2013. She works in the Office of Strategic Health Policy and currently focuses on health benefits, communications, and education. She is passionate about helping people understand their benefits. It's a full-time job. Tara has worked for the state since early 2011 and worked in Milwaukee before that. She earned her bachelor's degree in business administration and a graduate certificate in nonprofit governance and management from the University of Wisconsin-Milwaukee. So this is Tara first to my immediate left. Arlene Larson, well actually you've seen Tara before as well as Arlene. But Arlene started at ETF as a health policy analyst in 2002. She continues to work in ETF's Office of Strategic Health Policy. Prior to ETF, she worked at Blue Cross and Blue Shield of Wisconsin for 12 years, primarily as an underwriter. During a good period of that employment, she also acted as the client liaison for the state of Wisconsin account. She graduated from the University of Wisconsin-Milwaukee as well. Mary Richardson on my far left has been with ETF since 2013 and is currently an ombudsperson in the Office of Legal Services. Prior to that, she was a life and health insurance examiner with the Office of the Commissioner of Insurance, Canvas and Capital Funds Coordinator with First Unitarian Universalist Society, office staff at James Reeb Unitarian Universalist Congregation, and spent 14 years with the City of Madison. She, of the group, attended the University of Wisconsin-Madison. The format this morning is we are going to go through the entire program in one fell swoop. And after the program is over, we will take questions. With this many people, we really don't want to be slowed down and miss the opportunity to hear the full program. There will be a break, probably about an hour, but it'll probably coincide with the just about the end of the official program. So I do want to remind everyone, I know how important your cell phones are to you, but we'd appreciate that you turn them off, and if you can't live without them, please turn them to vibrate. Beyond that, again, I thank the group from ETF and welcome them and hope you enjoy their presentation. Thank you.
Thank you. Good morning, everyone. Okay, so here we go into the changes for the program for 2018. And just bear with me while I pull up. We're going to show them to you from our e-learning, which is accessible through the It's Your Choice section of the ETF website. So I'm kind of showing you how to get in here. This is the homepage of It's Your Choice 2018 on the ETF website. And if you go in here and say, I'm here for open enrollment, which is the first button here, you will get some easy steps to take to make all the considerations you should make during open enrollment. On the top here, we have some presentations you can watch to get the information in, I thought this was queued up. Here we go. All right, is it up there? Okay, great. Okay, so this is an e-learning presentation we put together that covers all the important changes for this year. Now, rest assured, if you don't want to find this information on our website, all this information is in the decision guide that will be mailed to you. They're in the mail right now. You could even get them today or tomorrow, probably Monday at the latest. So you will be getting them really soon. They were mailed out yesterday. This is what the cover of the book looks like that you'll be getting in your mailbox, so watch for that. And this is just some information of how to navigate this presentation if you look at it on your computer at home. One thing that I'll just point out is that you can jump to information over here from a menu, but also there's this little computer icon on every screen. And so on each screen, it shows you just the high level information. But if you click on the little icon, it takes you right to the webpage on the ETF website that shows you where the detailed information is. Again, same exact information that is in your decision guide you'll get in the mail. Okay, so I'm jumping in here to the changes to the state program. There's different categories of changes here, and I'm just going to go through them fairly quickly because we have a lot to cover today. Again, we'll take any questions that you have at the end. The most important thing to know this year is that we have several health plans that are not going to be participating in the program for 2018. So there are some health plans that are going away. I'm not sure if you knew this, but previously or currently we contract with 18 different health plans across the state to administer everyone's benefits, and that is going down to 10 health plans. People who have these health plans are going to have to choose a new health plan during open enrollment this year. So that is, if you walk out of here with one thing, if you are currently enrolled with any of these plans, you need to know that you need to change your health plan during open enrollment. So you have until October 27th. Again, open enrollment starts on this Monday, October 2nd, and goes through the 27th. So Anthem Blue Preferred Northeast, Arise Health Plan, Health Tradition Health Plan, Humana, and this does include the Humana Medicare Advantage plan. I will cover a little bit more of this in a little bit to talk about some options for anybody who's enrolled with Humana Medicare Advantage right now. And then also United Healthcare of Wisconsin. Okay, so another thing that you should be aware of, and this impacts a lot of people. Actually, the majority of the people that are covered under the state group health insurance program are actually with Unity Health Insurance. Now, if you live in the Madison area, you probably already know that they're changing their name to Quartz. They've had a lot of marketing going on, radio commercials, it's been on the buses, so you've probably seen that. Unity currently has two different, we call networks. One is Unity UW Health, and that covers primarily the providers in the Dane County area. And then there's Unity Community. Unity Community covers providers primarily outside of Dane County. So if you're with a Unity plan currently, you will automatically be enrolled with the Quartz plan that is the same exact plan. All that's changing for you is the name. So if you're with Unity UW Health, you will be in Quartz UW Health. Nothing changes except for the name. It works exactly the same way. It covers the same doctors. Nothing else is changing. Every year, our health plans, we require them to send you a letter in the mail before open enrollment and tell you about any providers that are no longer available. So Quartz did that. You should have gotten it in the mail already. Yesterday or the last couple of days. So that's what that was. So that does talk about any providers that are going away. But for the most part, that's the only thing changing, just the name. But Quartz has now become a larger company. There has been a merger with Gunderson Health Plan, which primarily operates in the western part of the state. The La Crosse area is where they're really big. And then also Physicians Plus, which operates in this area and a few other places. So here is the skinny on that. If you are enrolled with Gunderson Health Plan, you will automatically be enrolled with the Quartz Community Plan. Should have already gotten in something in the mail about that. And really the only thing that's changing for those people, they still have access to all the Gunderson Health System providers. They really just will have a larger network and be able to also see UW providers. So the Gunderson folks, they don't need to do anything. They'll be enrolled with Quartz Community, and basically they'll just have more providers to choose from. Now, the Physicians Plus merger is a little tricky because they cover people inside and outside of Dane County. So the way they're doing it is that if you currently have a primary care provider in Dane County, you will be automatically enrolled in the Quartz UW Health Plan, which covers Dane County. If your primary care provider is outside of Dane County, you will automatically be enrolled in the Quartz Community Plan. Now, for anyone that this impacts, you should have already gotten information about this in the mail from Quartz and Physicians Plus. They work, the staff at Physicians Plus who are now merged into Quartz have worked together on the messaging for that. You can always change plans during open enrollment if you don't want what you're automatically being enrolled in. We just didn't want all these people to have to pick a new health plan if it wasn't necessary, because it's really part of the same company now. The last change that I'll mention is that network health plan. They previously had a northeast choice, so you had to choose that network, the northeast, and then they had a southeast option. They're just merging it all into one. So no real change for those people. That will automatically be enrolled. You just wouldn't see that northeast or southeast thing on your ID card, and you have access to all the providers, both northeast and southeast. So they're covering the whole eastern part of Wisconsin now. Again, I just want to point out here that this is that little computer icon in the bottom right-hand corner, and that is where you would click to get more information about these changes. Okay, so this may impact some people in this room. The It's Your Choice Medicare Plus plan that was formerly, or is currently administered by WPS Insurance is now going to be administered by WEA Trust. So WPS's contract ends at the end of this year, and WEA Trust is going to be the new administrator. Nothing else really changes with the plan. The benefits don't change. The provider network's the same. You can still go and see almost any doctor that accepts Medicare. It's just going to be administered by a different health plan. You'll be working with a different company. You get a new ID card. So you will automatically be enrolled with WEA Trust. Again, you can always change plans if you want during open enrollment. Another one that I doubt impacts people in this room, but we have something called the state maintenance plan. This is just kind of like a safety net backup plan if we don't have a good tier 1 or the least expensive option in a county. That's where this plan kicks in to make sure that we have a tier 1 or a lowest cost option everywhere in the state. And there are some changes with that. If anybody is impacted by that, come and talk to us at the break or after the presentation. We can talk to you about it. Okay, this is this cool new interactive map we have available on our website. Now, for those of you that primarily use the decision guides that you get in the mail, you'll be happy to know that we did put a map back into the guides. And it's really clear. I think you'll like it. It's easy to use. It's over a 4-page spread, so it kind of sections out parts of the state, and then it shows you which health plans are available by county. Our new interactive map is really cool because we put some more information for you on it. So you can see, it's kind of hard to see on here, but if you click on a county, What will pop up is all the health plans available in that county. And it also gives you some more information at a glance. So it shows you their overall quality rating. Those are those stars up there. And it also shows you who the major providers are that they cover. So the major hospitals and healthcare systems that they cover. And then if you also click on there's a little circle there that has a little doctor icon. Shows up bigger when you look at it on a computer. If you click there, you'll get right to the provider directory. So that'll open up the book, the online book, of all the doctors that health plan covers. So if you're one of the people that need to change health plans, you can, this is a really great way to kind of shop around to see which plan might cover your doctors if you want to stay with a certain specialist or a certain primary care doctor. Now, you can request hard copies of this from the health plan. So if you're not a person that would want to go online to get this information, you can call the health plan that you're interested in moving to and ask that they mail you a directory. Okay, now this also doesn't impact a lot of people, but this is changes to our, what we call our It's Your Choice Access Plan. This used to be called the Standard Plan, and this is the plan that covers nationwide network. So this is a more expensive option, but then you have freedom of choice in which doctors you use. There are some changes to this. WEA Trust is also taking over this contract, so WPS currently administers this. Just like Medicare Plus, WEA Trust is taking this over. And there were some changes to the benefits here because what the Group Insurance Board did is approve changing the benefits to align with our uniform benefit that all of our HMOs cover. So the uniform benefits is what most people under our program, that's the set of benefits that all the health plans administer, the same set of benefits. So it doesn't matter if you choose Quartz or Dean or GHC, they all have the same benefits under our program. So this just aligned that with the benefits that everyone else has. I'm not going to spend a lot of time to go through these changes. They're fairly minor, and not a lot of people are enrolled in this program. Again, if you want to talk about these changes at all, feel free to come and see us, and we are glad to walk through the changes with you. They'll also be in your decision guides. There's a little bit of cost sharing difference. For the most part, positive cost sharing, so lower deductibles and lower out-of-pocket limits with this Access Health Plan. Okay, another change that everyone here needs to know is that this year we're requiring every single participant in the program to have a primary care provider. Most people have a primary care provider already. This is something we've encouraged the health plans to do all along. We really believe that a primary care provider model, somebody who knows you and can help coordinate your care with any specialists, is important. And it helps make sure that you're getting the right care at the right time. But we are requiring it this year. So if anybody doesn't have a primary care provider, we're urging you to work with your health plan to get set up with one. The health plans can go ahead and assign you one if you aren't working with them. You can always change it at any time. So they'll send you a letter saying, okay, your new primary care provider is Dr. Jones. If you don't want to see Dr. Jones, you can just call them and they'll change it. We're requiring them to give you information about what you need to do to change it if you want to. Another thing that's a change this year, and this came out of the state budget process, is that domestic partners will no longer be covered by the program in 2018. So, no more domestic partners. ETF is in the final stages of finalizing a letter that will go to anybody that's impacted by this change. It affected more than just health insurance, so there's impacts to disability and WRS, and it affects all the benefits a little differently. So anybody that's impacted will get a letter from ETF in the mail that's going to explain what the impact is by benefit type. The coverage for domestic partners will automatically end at the end of the year. So if this does impact you, you don't have to do anything per se with ETF except for find different insurance for the person that's losing coverage. There will be COBRA continuation offered, and that will come in the mail also from ETF. So that'll be a different mailing from ETF that explains the COBRA continuation process for health benefits. And I'll just mention one more thing. This also impacts any supplemental benefits through our program. So any vision or dental benefits as well. Okay, I'm gonna skip over that one because it doesn't really impact retirees. These are just minor changes to the uniform dental benefit. Most of them are positive add-ons to the benefit. The only benefit reduction is that, that annual bite wing x-ray, so you bite on the thing and they take your x-ray. Most people only get one of those a year. The dentists usually only do one a year. But technically in our benefits, you could have gotten 2 of those in a year. It's being reduced to just cover 1 per year, which is pretty much the industry standard there. There are some positive changes to the benefits. The sealants are going to be increasing. There's also this temporary filling thing that's mostly used for kids. And then, but this one is a positive one that may impact people in this room. There's a new program or plan that's part of the benefit that if you have some sort of a condition, a medical condition that is impacting your teeth, it can cover more benefits to help with that. So there are certain disease conditions, there are certain cancers that impact your mouth, and this will cover more benefits under the uniform dental benefit. And talk to your dentist about this, or Delta Dental could give you any details if you want the details for anything that you might be concerned about. Okay, here are some changes to pharmacy. So this is your prescription drug benefit. Now, most of these changes do not apply to people on Medicare. They're for the pre-Medicare retirees is where this comes in. One is that CVS pharmacies, and this includes the pharmacies that are in Targets, are no longer going to be considered in network for our program. That's kind of the big change that'll impact, some people who like to use the Target pharmacies to get their prescriptions. Again, this does not impact people on Medicare. It's only for non-Medicare. And then there's some other changes that impact less people, but I'll just cover them quickly. One is that our mail order pharmacy is changing. The vendor for that is changing. So it was Welldine RX. It's now going to be ServU. They were able to give us better pricing. They have a great reputation for customer service, and they're also based out of Milwaukee, so it's a Wisconsin-based company. Navitus will be sending you information if you use the mail order pharmacy about the transfer, what you need to do exactly to get your prescription set up with ServU. And for those of you who don't use this, it is something to consider where you can just get a 90-day supply. If there's medications you take ongoing all the time, you can just, a lot of times it's less expensive and you can sign up and then they'll just be delivered to you in the mail. So you might want to look into that. Another one is our specialty drug pharmacy. So this is changing. This is for those high-cost specialty medications that require extra care. And the pharmacy is changing from Diplomat over, there's going to be 2 options. One is the UW specialty pharmacy, and then the other one is called Lumicera. Again, you'll receive information in the mail from Navitus that'll explain exactly what you need to do before that transition takes place. Okay, a couple more things. There are a couple things that are going to be coming off of the drug formulary. These are things that have been available now for several years over the counter, and they've just remained on the formulary, and they're now coming off. This is just helping save the program some costs. As you know, probably you've heard, prescription drug costs are really expensive and rising all the time. So the 2 main things that are coming off are the Flonase. It's a steroid nasal spray for allergies. You can get that now and anywhere over the counter. And the other one is certain heartburn medication. Prilosec is the over-the-counter version of it. So now, if you use those medications, you'll need to just buy them off the shelf at wherever you buy your medications. So starting with January 1st, those won't be covered through your pharmacy benefit anymore. Again, this does not affect Medicare members. So if you're on Medicare, you can ignore this. It'll still be covered. It's the non-Medicare people. Okay, I'm gonna just move it along here. There's a couple more things. One is a program that's voluntary. If you take a lot of complicated medications, you'd be notified to say, hey, you're eligible for this program and we can help you with your medication management if you want. Totally voluntary, just an add-on service. Another thing is that there's a discounted drug list that's going to be available. It's for things that aren't covered under our program, certain lifestyle drugs, weight loss, cosmetic things. But if you use these, you can still get a discount on them through Navitus, who's our pharmacy benefit manager. Okay, and then there's some minor changes to the vision supplement through VSP. That's our supplemental vision plan that is available to retirees. These are all good things. Now you can spend up to $150 are covered on contact lens or glasses frames. Also, UV lens protection is going to be covered under the program. So, usually you pay extra on lenses to have that added. Now that'll be part of the benefit. And then contact lens, when you go in for that exam, it'll be $20 cheaper. And then some other things are added to the benefit for, like if you had a sudden loss in vision, that kind of thing, you could use your VSP benefit for that. Okay, there's a couple other changes to the Epic Dental. These are, so the add-on dental benefits. Basically, the benefit is increasing to $1,250 in a year, and also the waiting period is going away on that. And then also with Epic Dental, previously, everyone didn't have an enrollment opportunity every year during open enrollment to get this benefit. So if you didn't get it when it was first available to you, you're kind of out of luck. Now you can get it, but there's some waiting periods and you have to wait a few years for the full benefit to kick in. Again, we can talk to you about the details of that if you're interested. And then really one of the last things that you should know is that the Well Wisconsin benefit is still available to you the way that it has been. So if you do the biometric screening or, usually those things that you automatically do when you go to the doctor, if you submit the results to Stay Well and also do an online questionnaire, and then in 2018, the change is that there's a third requirement that is Stay Well is going to be sending you information about in the mail. It's a third easy engagement activity. It's basically going to be a list of things that you can choose from. One of them might be watching a webinar about a wellness topic. There'll be a whole bunch of things that you can choose to do. And if you meet the requirements, you can get the $150 wellness incentive. Again, Stay Well will be sending a lot of information about this directly to you in the mail starting in January. Okay, and then the other thing, I'm not going to show this, but I just want to point it out. We do have a helpful it's a 5-minute video called Take Action, and it does walk through all the things to think about during open enrollment, making sure that your health plan is still covered, making sure your doctors are still covered. It walks you through how to do all of that. It's just a quick little video. And it also goes along with a printable checklist, so you can print out this checklist. The checklist is also in the decision guide, so you'll be getting it in the mail. And it kind of just walks through the steps of open enrollment. Okay, now I am going to switch topics and talk a little bit about Medicare plans. So we wanted to make sure that we cover what the available Medicare plans are for you. Because we're learning the more that we kind of try to explain benefits to people that not everybody understands that there's different plan designs that you can choose from and really different benefit options. So a lot of people, when they turn 65, they just kind of stay with, if they had Dean, they just stay with Dean. And they don't really realize that there's other options out there available. So I just want to touch on what those are. We tried to do a better job of explaining it in the decision guides this year. So you're going to see a chart when you get your guide in the mail that will explain these plan designs next to each other. And you'll see the pricing information in the decision guide too. And so some people are kind of surprised to see that there's this Medicare Plus plan that's actually less expensive than some of the other plans available to you. But there are some differences, so I'm just going to touch on those quickly. So you have what we call the It's Your Choice Health Plan Medicare. That's this one. And we're using this plus sign symbol. All of our Medicare stuff in our materials is all purple, so you can recognize it. So when you get your guide in the mail, you can open it up to the purple pages and you'll see the Medicare information. You'll see this next column here. It covers what the premium amounts are, monthly premium. This doesn't have the dollar amounts in there, but what it does is it shows you that the Medicare Plus premium is a little bit less expensive than the other premiums. Now, the other premiums vary by which health plan. So the next thing to think about is the coverage area. So with the health plan Medicare, the coverage area is, for the most part, just inside Wisconsin, and you have to stick to the coverage area. So, like I was talking earlier about the courts and the inside Dane County, outside Dane County, all the health plans choose which counties they're going to offer as their service area. And there aren't really out-of-network benefits unless there's an emergency. You have to see doctors in those coverage areas. With the Medicare Plus plan, you can see pretty much Medicare providers anywhere in the country and also even worldwide. There's really a breadth of coverage of providers that you can see under that plan. The other thing to note is who it's administered by. So the top line, the It's Your Choice Health Plan Medicare, that's the Medicare plan that is offered by all the health plans that we cover. So the Dean, the courts, the GHC, the, who am I forgetting, network, all those health plans. Again, it's the same uniform benefit, but you've got to look at each plan and figure out which ones are available where you receive care and then what providers are available. The Medicare Plus plan is only administered now by WEA Trust. So it was WPS, now it's WEA Trust, and again, you can see providers pretty much anywhere. But there are some things that plan doesn't cover. The Medicare Plus plan only covers benefits that are covered by Medicare. So there are certain things that the other little bit more expensive plans cover that this lesser expensive plan does not cover. Some key things are hearing aids and routine vision and hearing exams. Those are not covered by the plan because Medicare doesn't cover them. The other thing is that there's certain durable medical equipment that's not covered by Medicare, not covered by Medicare and therefore not covered by the Medicare Plus plan. So that's the distinction. If Medicare covers it, Medicare Plus covers it. If Medicare doesn't cover it, then Medicare Plus does not cover it. And then I just wanted to spend a minute talking about Medicare Advantage because that is going away for 2018. Now the important thing is that if you're in Medicare Advantage, you like Medicare Advantage, this is just a 1-year gap in us having a Medicare Advantage plan. Unfortunately, Humana decided not to participate in the program for 2018. And with the timing of how things work, we couldn't get a new Medicare Advantage provider in time for open enrollment. We are working on a procurement right now. It's about to hit the streets next month in October to get new Medicare Advantage options for 2019 and beyond. So if you have Medicare Advantage, some people have Medicare Advantage because they had Humana before, and then they turned 65, and they just kind of naturally rolled into the Humana Medicare Advantage plan. Our Medicare Advantage plan covers the same exact set of uniform benefits, but the one thing about it that is nice is that it covered a nationwide network. So if you live part of the year in a warmer state, you could have the Medicare Advantage plan and get your care in Florida or Arizona and still get your care in Wisconsin. You could get your care anywhere across the country, and the same set of benefits and the same exact prescription drug coverage for all of our Medicare plans. What I wanted to do is just show you a couple of key differences for anybody who wants that nationwide network, because what we're really saying is that right now the only plan we have that covers nationwide is that Medicare Plus plan that I just talked about. So this shows a few differences and similarities that I kind of already talked about. Worldwide coverage with Medicare Plus, same exact prescription drug benefit, but you have to be aware of the fact that it's not going to cover hearing aids or those routine vision or hearing exams or certain durable medical equipment. Okay, again, if you have any questions about this, let us know, and we will answer your questions. But I wanted you to just be aware that out on the ETF website, we just released a whole new series of little videos. They're all 3 to 5 minutes long, and they all are focusing on your health benefits and retirement. So they cover things like, what do you do when you're considering retirement? And how do you have a smooth transition? But they also cover how to pay for your health benefits in retirement. So this covers the whole accumulated sick leave thing and all those things that you might have questions about. It also covers what if I'm newly eligible for Medicare? I'm about to turn 65. What do I need to do? What automatically happens? What do I need to do? What do I need to know? How do my benefits work? It covers all of that in just a short little video that's kind of entertaining to watch. And then there's also a printable resource sheet with that gives you all the key takeaways. So if you watch the video and then you think, okay, now what was I supposed to do? You can just look at that sheet and it tells you exactly step by step what you need to do. We really tried to simplify that process because we knew we didn't have really simple, easy information to understand about aging into Medicare. So that is out there in a video. And again, if we have time at the end, we will show you a couple of these so you can get a sense of what they're like. So there's 5 of them out there in total covering different topics. That's what the new to Medicare one looks like. And this is what they look like on our website. So you can see you can click on the different ones, and then whichever one you click on will show up big on the screen. And then underneath is where you find those resource sheets. This is an example of what one of the resource sheets looks like. So this is the new to Medicare one, and it just gives you an overview of the parts of Medicare. You know, not everyone understands how those work, and it talks about what to expect, what changes, what stays the same. So we hope that those will be helpful for you if you're confused about that, because it's a little confusing. Okay, I'm going to turn it over to Arlene now. Thank you.
All right, and I'm going to try to use this mic. Hi, again, I'm Arlene Larson, and I am here to talk to you today about your sick leave credits and managing them. So first off, when you retire, if you have sick leave hours in excess that you haven't used, those will be converted into credits by your employer as long as you are insured with us at the time that you retire, and then that is transferred to us so that we're made aware that you have those sick leave credits available. So then the next step is that you are automatically transferred from your former employer's health insurance group to the retiree group that uses sick leave credits to pay for their health insurance. And we set up your insurance automatically to withdraw the premium payment from your sick leave credits. And that's how that works. Let's say then that your spouse is still working And they have comparable coverage to what you have at the state. What's comparable coverage? That is basically the same as what is currently offered to active state employees. So what that means is currently a state employee has a $15 office visit copay when they see a primary care physician, $25 at a specialist. If you go into the hospital or have lab work done, there's a $250 individual deductible, and then there's some co-insurance with a maximum out-of-pocket of a little over $1,000 an individual, $1,250. You also have a very good drug coverage. If you go get most generic drugs or some low-cost brand name drugs, you pay a $5 copay. For more brand name drugs and for some higher cost generic drugs, you pay a $15 copay. And then there's a limit on how much you will pay in those copays for those every year, which is $600 an individual. Very good coverage. So if you're going to escrow your sick leave, you don't want to use it, you're covered somewhere else, you have to make sure that that insurance that you've got is the same to what you have as a state employee. Then you can fill out this form, the sick leave escrow application, send it into ETF, certify you've got that. You have to keep that comparable coverage the entire time that you're not insured by us. Okay, so then you're covered by your spouse, and let's say that he or she retires. They're losing their employer contribution, they're losing their coverage. Then you want to send a form to us, and I'll show that to you later, to re-enroll and to start using your sick leave. And we'll talk more about that. Assuming that you're insured with us and you're using your sick leave, then at a certain point it starts to run out. 3 months before it runs out, you'll get a letter from us. And it'll tell you, and I'm going to show you that letter in a little bit. It's very detailed. It'll tell you all of your options. It'll tell you how much you still have left and what you want to do next. And so you can decide. And what, if you want to cancel, it tells you how you can do that too. So in this letter, some of the options that you'll have when your credits are depleted is, number one, we would automatically enroll you into having your premiums deducted from your annuity if your annuity is large enough to cover those health insurance premiums. If your annuity is not large enough to cover the premiums, then we would automatically set you up so that your health insurance is what we call direct pay, which means that the health insurance company will bill you directly for your medical and your Navitus prescription drug coverage. So that would be automatic. You'll see on this slide that if we set you up for an annuity deduction, your premiums are actually taken out of your annuity about 7 weeks before the due date. And I've got a slide later that'll show that in better detail. Okay. Another option that happens is if your spouse has accumulated sick leave with the state. If that's the case, when your credits are depleted, we will automatically move you in what we call a spouse-to-spouse transfer to your spouse's account. The small amount of credits that you have left will automatically be moved into their sick leave account. You will be set up with them as the subscriber. You'll get new ID cards listing them, and your coverage will just continue for as long as those sick leave credits remain. Then when those credits run out, then again, you'll get the letter saying, here's your next option. All right. The letter will also answer the question of if you want to cancel coverage. Some people, when they've got their sick leave running out, they want to go to other insurance elsewhere. Maybe their spouse is still working, or maybe they just decide to go somewhere else. You can do that. All you need to do is send us a letter, sign that, or you can send us an email. The letter that you get saying your sick leave is depleted has a box on page 2 that you can fill out and send to us, letting us know when you want to cancel. Please let us know what the date would be. If you don't specify a date, we will automatically terminate your coverage the end of the month in which we receive that letter. So if you send it in to us today, we would cancel your coverage effective October 1st. If you do have some sick leave credits left, and if you're going to go off to have some kind of comparable coverage, you may really want to escrow those few credits, because then you get some special enrollment opportunities to come back. If you don't, everybody here, if you cancel your coverage, you'll be able to come back during It's Your Choice every year for coverage to begin January 1. But if you have some sick leave credits out there, and let's say you've got comparable coverage, that coverage ends, you get a special enrollment period. So when that coverage ends, let's say your spouse loses their employer contribution for their coverage, you send in your sick leave unescrow re-enrollment app, I'll show you that in a minute, and you can start at that time. Another option, if you've got some sick leave credits, is during It's Your Choice, you can send in your application, but you can specify a date in the following year that's later than January 1. So let's say, for example, you get Medicare that's going to start for you on May 1st. So you send in your It's Your Choice application saying, I want to pick up coverage starting May 1st, and I've got my comparable coverage, and here we go. You can do that when you've got some sick leave credits escrowed. However, if you don't and you cancel your coverage every year during It's Your Choice, you can come back for January 1st. Okay. Here is the sick leave letter that you'll get. This is page 1. As you can see, there's a lot of detail on there. Whoops, I need the pointer. Okay, so on this top in the yellow, this is an example. It says how much sick leave is left to you. It says what your monthly premium is. It tells you you have insufficient funds effective July. This is an old letter. If you want to continue your coverage after your sick leave has been exhausted, we will automatically either move you in a spouse-to-spouse transfer to activate your spouse's account, or we'll deduct the premiums from your annuity deduct, so we'll automatically move you to an annuity group, or you'll set up as, you'll get a bill from the health insurance company. And if you don't want to, if you want to cancel, then you go to page 2. And then page 2 tells you that if you don't want to cancel, here you set that I agree that I'm going to be leaving, and if you've got sick leave credits, we will escrow them for you. So that gives you an example of that letter. Okay. I had talked about timing. So some people, when they want to, when their sick leave is running out, they are very concerned that they don't want the health insurance premiums coming out of their annuity. So all you have to do is give us enough leeway. We deduct the health insurance premiums from your annuity, when that happens, about 7 weeks in advance of the month of coverage. And we call that cutoff. It always happens the second Friday of a month. So let's say that you decide today that your sick leave's running out and you want to cancel coverage. You email us or you drop a letter over at ETF. We'll cancel your coverage October 1st. But your annuity has already been impacted. You've already seen that deduction on your annuity. So to avoid that, to avoid any time in, no, it's not working, in the window between August 11th and September 30th, that's when the deduction is taken, do it early. However, we will refund your credits. Once we get that, on the next annuity payment you'd get, you would see that adjustment to refund the amount that was reduced from your annuity. Okay. If this is a copy of the sick leave re-enrollment form, so I wanted to let you see that too, in case you've got those credits out there and you want to come back into our program. Okay, and now I'm going to turn it over to Mary.
Most of us, if you are retired and you are age 65, you need to file for Medicare. If you have a spouse on your plan as well who is Medicare eligible, they are required to file for Medicare as well. And the reason being that our health plans require that if you are eligible, all eligible parties on our health plans need to be on Medicare, because if they're not on Medicare, The health plan will still only pay as if they were, meaning 20% coverage as opposed to the full coverage. So that's number one. Anyone else who you currently have on your plan, say you have an adult dependent child who is disabled, while you're working, they don't need to be on Medicare. But once you retire, again, that shifts, and they do need to file for Medicare as well. So, but the reason that that is helpful, now, of course, if you still have dependents under age 26, they're not Medicare eligible, so that doesn't apply. This is the Medicare eligibility statement. Anyone who becomes eligible for Medicare, this form is required. Now, you're not all going to turn 65, and your spouse is not going to turn 65 at the same time necessarily. So each time that a new enrollee to Medicare happens, you're going to want to submit this form. The subscriber information is always going to be whether or not you're already on Medicare. If your spouse is newly joining Medicare, you'll fill it out with the subscriber information at the top here. And then the second section where it says prescription drug coverage. All right, if you're staying with our plan and you're going to continue the Navitus benefits, check the box that says, do you have other prescription drug coverage as no. There are some circumstances where people want to keep another prescription drug plan. In that case, you would fill it out differently. But again, whenever you're encountering anything on these forms that seems a little bit fuzzy, or you're not quite sure how you want to fill it out, call us. Trust fund specialist staff the call center. They'll go over any of these forms with you. And then that gets signed and submitted as well. So again, why is this important? As I stated, if you retire and are Medicare eligible and do not enroll, your claims are going to get paid as if you should have been, leaving you with some pretty hefty bills. And when Medicare A and B are a part of your plan, your premium reduces significantly. And also by reducing the amount of the premium that you're going to be paying, if you're still using your accumulated sick leave account, that's going to extend the life of that account as well. And as you can see in the examples up here, the non-Medicare premiums for a single person and for family coverage reduce once you have family coverage with still maybe some non-Medicare dependents. You'll see it's going down from that $1,600 to the $1,100. And then if you have yourself and a spouse or any eligible dependents who are Medicare eligible on Medicare, it reduces further to that $470 or $937. So it's always a good idea to make sure that you've got that in place. And remember that you will still have the cost for Medicare deducted from your Social Security or be billed for that separately. That is not included in the premium. So now, the other things that you want to know is, okay, when you have questions with regard to Medicare, we're not the Medicare experts. Medicare is a federal program. Obviously, we have some knowledge with regard to how it works, but always for the best information, either call Medicare directly, call the Medigap helpline if you're having trouble with some part of the prescription drug program, which is considered the Part D plan. Any other questions about how your health plan works? The Ombudsperson Services line is in your documentation there as well. The toll-free number that you see there, that 877 number, that gets you directly to the call center. And again, they're staffed with 20-some trust fund specialists, and then even more during open enrollment. So any questions that you may need to have answered or want us to look into further, you certainly can call them. Ombudsperson Services, we tend to handle a little more complicated level of problems with insurance coverages or any other questions that you may have, even about other benefit programs with WRS. So you certainly are welcome to contact us. And should you decide to leave our program, your opportunities for looking for other coverage, if you've been near Medicare eligible for a while or have been on Medicare for a while, you probably have noticed your mailbox about this time of year. It's stuffed with information from a variety of companies that may want you to switch plans. The thing to remember is that most of those plans, they may be a lower cost, but your accumulated sick leave account, if you still have that, can't be used for them, and they are different than our plans. They may be an advantage plan, they may be a supplement. Ours are considered secondary coverage, which means it wraps around your Medicare coverage. As both Arlene and Tara stated, you've got additional benefits as a part of those plans. But if you're still determining that you are going to leave, you want to determine where it is you're going to be. Are you going to be living within Wisconsin still? Are you going to be moving out of state? That could be a consideration. Talk to your current providers. Sometimes they have specific plans and companies that are easier for them to work with and or associated with their plans that make it a good transition for you. Talk to your pharmacists. Pharmacies, again, have some experience in their area with coverages that are easy to work with or helpful, or they see most of their people using. Talk to your friends. They're also a good source of helpful information with regard to the plans. And then, again, if you do decide to cancel, you heard both Tara and Eileen talk about the ability to come back. You certainly can do that during any open enrollment. And again, any questions always with any of our plans or information, please just give us a call. We're always ready to help you. Okay?
Okay, really quickly, I'm going to wrap it up here. Okay, so I just wanted to talk to you really quickly about what's next, what ETF is working on for the future with your health care options. So one thing that I already mentioned is that we're looking for new Medicare Advantage provider or providers for 2019 and beyond. I just want to set the record straight and let you know that what we're looking at is just adding that Medicare Advantage option back in. We're not looking at replacing all the options and only providing Medicare Advantage or anything like that. We really, as it states up here, we want to expand your choice. We're hoping that we can get a Medicare Advantage option that has lower monthly premiums somewhat significantly than what you have available to you today. So that's really our goal, is to have high quality, excellent benefit package, have some more choice, and have maybe something available with a lower premium. You probably read in the WRS News, you all read that cover to cover, right? That we are going to be sending out a survey. We're going to be surveying about 1,500 people who participate in our program that are nearing Medicare age or are already Medicare age about what they want to see in their healthcare options in the future. So if you get the survey in the mail, it's going to be a random sampling, but please consider providing us your feedback because we take the feedback seriously, and that is the information that we will be looking to inform our recommendations to the Group Insurance Board about what kind of a Medicare Advantage plan and just your Medicare options in general in the future. So thank you very much. Back to Jack.
Yes, thank you very much. We will take a 10-minute break now. I just wanted to remind everyone that you did pick up evaluations.